I'm Kevin.
I'm Zach.
And I'm Andrew.
And we're from AIC, and we did NDT, which is neurodevelopmental treatment. And with that, some things to know are key points of control is where the therapist is going to position their hands on their patient and inhibit faulty movements or typical movements that are with, for us it was cerebral palsy with that condition, and also facilitation where they're going to stabilize the child at their base of support, their hips, shoulders, wherever it may be for that specific movement to build patterns that you want to happen with the child. All right, so for one NDT movement for a child with cerebral palsy is the sit to stand, and then to make that fun, we're gonna have them shoot a basket at the end. And so the first thing I'm gonna wanna do is position Carly. Obviously she's bigger than a typical child that you'd be working with. So one thing you wanna do to start off is position her 90-90 or as close to it as you can. If they do have a lot of spasticity, you're not going to get that perfect 90-90. But one thing you want to do is try to position as close as you can. And then one thing that they're going to typically try to do is they're going to lean backwards and try to push off and get backwards. So one thing you're going to want to do is inhibit that movement and facilitate at the hips and try to get them leaning forward. And then you want them to instruct them to grab their hand on the chair to help stabilize there, and then they can grab the ball with one hand and shoot it, just so they can have that increased stability there. All right, so you're gonna facilitate at the hips, and Carly, can you stand for me? Good. Grab the ball, keep holding on, shoot it. Great, good job.
So our next position is prone on a swing to facilitate reaching, and we're gonna work on shoulder flexion for Carly, who's the patient right now. So as they're prone on the swing, I'm gonna help eliminate gravity and give some support to her shoulder while stabilizing at her scapula to help facilitate the movement. So as we have her working on reaching and me giving her a little assistance, we're going to have her trying to also pop up bubbles with her fingers in order to facilitate some type of movement in the shoulder and range of motion.
So the first thing, someone with cerebral palsy has a lot of tone. So we're gonna be facilitating them in the quadruped position. So you wanna facilitate at the hips and pull their hips up, making sure they're aligned with their spine. It's important when you're facilitating at the hips that you keep their hips up because they're gonna wanna inhibit and dip down after long duration. As a visual aid, you want like a parent to come in and bring one of their favorite toys just for motivation, and this will also help keep their neck up and extension instead of having them dip, because once they dip, their whole positioning is gonna plunge. So, and then just when you reach, good. Another thing about this positioning, it helps improve their trunk stability, and as well as that, their core stability and core strength, and it will prepare them for creeping.
All right, so one more position we have is rolling for a child with cerebral palsy. The NDT for this is you're going to be facilitating the key points of control at the hips, and then possibly the shoulders if they need it, or the knees and the shoulders if they need it. One good thing to use to help facilitate their head turning towards the direction that you want them to turn is using a toy that they're interested in to kind of get their attention. You're going to face it that way so you see the child turns their head, so that starts the roll. And then the first thing you want to do is kind of warm them up, get them ready. You're going to talk to them, kind of get their arousal level up so they want to start rolling towards what they want to do and play with toys. And then so you're going to grab the toy and get them to turn their head that way. So she's interested in turning that way, and then the direction that you want them to turn, you want the leg facing that direction or closest to that direction down, and then you're going to grab the knee and kind of turn them that way, and then that'll get the rest of their body to roll that way as well. All right, so now we're going to restart. And then if that's not enough facilitation, what you're going to do is you're also going to grab the shoulder as well to help turn. So you're going to start with the knee rolling that way, and then also give a little support at the shoulder to help complete the roll.